Hello and welcome. We brought back Dr. Pannu today. Dr. Pannu, welcome back to our channel for a second time now.
Thank you.
Dr. Pannu, we get to know you from your previous interview, your journey, and then your importance on research. And now, you being those viewers who are listening for the first time, they should go and check out the previous video, Dr. Pannu, is that, you are one of the few percentages in the country trained as an interventional pulmonologist. So tell us about what you're up to now. What made you passionate about in the topics we have seen you that you are very much active on lung screening and so on and so forth. Of course, being an interventional pulmonologist, that's your bread and butter. But tell us that how big is the problem and what made you passionate about it?
Well, yeah, you're right. Being an interventional pulmonologist, so basically what I am is I'm a pulmonologist, but I'm trained in advanced training in doing procedures of the lung. So my field itself makes me deal a lot with lung cancer and cancers of the lung. But however, what made me more passionate about the field was the fact when I realized that even in my mind or in most people's minds, we link lung cancer with smoking and somebody who's very elderly. And there is a taboo that or a stigma that goes with it. But however, when you work so closely with patients, you realize that it is really much bigger than that. It affects all ages. It does not discriminate between smoking, no smoking. It affects men, women alike, and it has been affecting more and more people now. While all the cancers are decreasing, lung cancer is also decreasing. However, the impact of it still stays more than most other cancers that we talk about. And other cancers, including breast cancer, prostate cancer, colon cancer, which get so much support so that they can develop new treatments. The patients can be adequately screened to get as much preventive services as much as possible. However, lung cancer is causing the most deaths than any other cancer in men and women alike world over. However, it only receives about 1/10 of funding as any other cancer. And so that intrigued me. Why that's so when it's really affecting most of the population? Why is it ignored? And then it enlightened me more about the taboos around it, and the healthcare disparities that are around it, and how much we have to do in that realm, and how many lives are there to save with simple steps like screening and just following guidelines regarding lung nodules. So that's the process of trying to move towards early detection and helping my institution do it. So one step, like I said, one step leads to another. So it started off with just finding so and it brought up a lot of healthcare disparities that are around us, a lot of taboo and lack of support that happens towards this process. And it intrigued me to gather more and more data around it and try to raise awareness. So I'm hoping to, and I'm trying to, amongst my patients as well as the staff around us, as well as the leadership in our hospital, to create more and more funds regarding this process, so that around us we can um, promote the motive of lung cancer screening as well as early lung cancer detection, how to build a lung nodule program, how to promote early lung cancer detection amongst other physicians around you. And we realize there are a lot of knowledge gaps, and how much effort is needed to fill that still. So we're still at baby steps. At my institute, I'm trying to build a lung nodule program, which will partner with the lung cancer screening program as an early detection effort. And let's see where that goes. So, yeah.
Well, thank you so much for doing that. You talk about the taboo part, like there's a taboo around it in as well. And there's a biggest myth, like, if you smoke only, you're going to get lung cancer, or the chances of getting high if you are lung cancer. What can you tell about the people who never smoked? And what are the stats around it, or at least what are the taboo we should break?
So, 65% of lung cancer that is caused is adenocarcinoma, and a lot of it is in patients who had never smoked or have quit smoking decades ago. So we keep concentrating on the portion of smoking and quitting it, and that's where the patients find them stuck. A lot of times they don't even show up to their clinics because they're just in the way of just saying that if they have lung cancer, they seem apologetic as if it's because they were smokers. So because of that, and just ignoring the statistics around how much non-smokers can get cancer, how much women who don't have never smoked can get cancer. There's this element of shock that happens when you tell somebody that, oh, this could be lung cancer, and they go, I never smoked, this can't be lung cancer. No, it can be lung cancer. So that's one thing where we are mistaken, and that's one thing where more and more awareness need to be raised. There was recently a study in Asia where they tried to implement screening for non-smokers also. So right now, the screening efforts are for high-risk population, means people who have smoked and are above a certain age. But if 65% of cancers are in patients who don't smoke, then there should be a screening effort there too, to carry the bulk of those. So there's recently a study that came out that there could be a benefit of screening in non-smokers too. So time will tell. Just like where you screen everybody for colon cancer above a certain age, maybe that's what we need to do: screen everybody for lung cancer. I remember when I had just come to the United States, it was 2010. um, just before that, people used to laugh at the idea of there is CT scans for lung cancer screening. It was thought that it was hilarious, it was like a waste of money and all those things. But as we try more, as we get more evidence, we realize that it decreases mortality by about 20%. So that's a huge number. So there's a lot that we don't know, and I think steps are being taken towards that. It's about keeping a push on it.
So other than the CTs, can you mention what are the screening tools you suggest? Or of course, we all know the signs and symptoms of lung cancer, for that matter, early stages. But what are the screening tools you at your disposal, and then what you suggest to look out for our layman public?
Well, the approved screening tools are only the low dose CTs as of now. X-rays did not prove as good screening tools as of now. But if you were to include smokers as well as non-smokers, and those kind of studies have not come up yet, especially in the developing world. Those studies have not come up yet, because that this may be more relevant there, because not everybody may be able to afford a CT scan in those places. So right now the evidence is towards low dose screening CTs, and that's what we have now. Prevention, this is your early detection, right? The prevention is always, of course, to be wary of course, stay away from smoking, as well as passive smoking, not only active as passive. But in the non-smoking world, especially in the United States, to test yourself, test your homes for radon exposure, which is the number one cause of lung cancer in non-smokers. So, as well as toxic exposures at work, occupational exposures at work. So that's something important that needs to be to get more and more awareness, and to just talk about the presence of lung cancer in a way where nobody's ashamed to talk about it. Now, recently there's been a project which is called the White Ribbon Project. It was started by a lady who was very young and just out of the blue was diagnosed with lung cancer, and everywhere she saw herself being hesitant and being treated differently, because or looked with suspicion, like, oh, is this why you did something, like as if she did something to get it. But then she started this project which she called the White Ribbon Project, where just like how we talk about breast cancer, we wear pink ribbons. We support breast cancer, we support colon cancer, and just wholeheartedly to raise awareness in community that it's present, it's more common than you think, and it's okay to talk about it. So I think those practices sort of bring out what is hidden in the open, as well as when dialogue starts, then more awareness can start, because nobody knows all these things to begin with without talking about it. But once there's a lack of this taboo, then there won't be a scare or humiliation behind it.
Absolutely. Any comments on lung cancer association with the The indoor air quality or air filtration? I don't know if you have any data or any advice on that part.
There's data that comes, off and on, but the validated studies currently are only around radon. As well as, I'm not sure in what happens in other countries, but here in the United States, you can always check your air quality before you move in, you know. So the most strong exposure is known with radon. So everybody should be checking that. But you'll be surprised to hear how many people don't even know about it and have never even known about that exposure in their homes.
Absolutely.
Exposures which are now pretty minimal was asbestos was the other big one, which is now banned in construction materials. But for men and women who worked on shipyards as well as old homes or were construction workers in the 70s, 80s, most of the soundproofing was building included asbestos there.
Asbestos.
So because of that reason, they may have had that exposure. And it is striking that an exposure like that at that point, even for a few years, how much effect sometimes it can have on presence of lung cancer several years later.
Absolutely. At the time of recording of this video, we are almost in the tail end of the pandemic, I like to think, or in the middle of the pandemic for that matter. Any data or suggestions that pandemic SARS-CoV-2 virus or COVID-19 disease has influenced the incidence of lung cancer, either delayed the diagnosis because screening was not done, or maybe that has some adverse event, but then more people are developing. Of course, it'll take few years for the cancer diagnosis to come out, but any early takes from your practice or and your knowledge?
So when COVID-19 started, obviously the screening practices had to be delayed, as well as the follow-up CTs, because the influx of patients going to the scanners was being reduced. So there must have been delay over there, and data came out specifically regarding delay in these patients, specifically in the socioeconomically low population. Healthcare disparities did widen during that time, whereas the patients who did not have access to much healthcare or education or finances did take a difficult time over there. Um, Recently, a very interesting study came out. I think it was out of Taiwan, if I'm not sure, if I'm not wrong. It was about how during the COVID time, actually, the lung cancer detection in somehow may have gone up because there were so many CT scans done on so many different patients. So there were 20% more CT scans done. And while they're not really screening CTs, but they offer an opportunity for this, lung cancer detection through detection of incidental lung nodules. You may be looking at COVID, but you may see some COVID, but there may also be a nodule because of all these scans done. So how much it has, we know there were more scans done in this time, but how much it has impacted the detection process? Have we missed more? Or have we detected more only? Further studies will tell, but that's where it's pointing at right now. But
Interesting.
treatment disparities definitely increased, and that data came out sort of mid-COVID.
No, the interesting observation. Only time will tell that either we are missing and delaying and detecting more severe disease, or just sheer because we were looking more for COVID-19 and SARS-CoV-2. It end up getting us incidental findings of early lung cancer. So I think some of the longitudinal study will tell if it has impacted positively, or at least highlighted the problem which was there for many, many years and now it got impacted. Anything you want to add there, or conclude today's interview?
Well, it's been an absolute pleasure. And there may be, I would just like to say that there may be several questions that may come to your mind, and everybody who may be watching this video may be in different times of their lives, in their careers. It's always good to ask a question, because that's the only way to find an answer. So if you do have questions, something specific, or even something you would like to discuss in more detail, you do comment, or reach out to Dr. Kashyap, and I'm sure he'll let me know. And he himself can answer a lot of your questions. So keep asking, and keep inquiring, and keep progressing.
Thank you so much. You did my task when I say our reviewers to like, comment, and subscribe to our channel. Please write down the questions if you have it. This is not a medical advice. This is just a journal physician scientist advice we can provide you. You should reach out to your primary care doctors if you have any concerns and questions about it. We'll be happy to answer some journal questions, not as a medical advice. Dr. Pannu, it's an absolute pleasure to have you here with us today. Thank you so much for being here. Thank you so much for what you do. And thank you so much for being one of the top trained physicians in the country, with a very few % of people get to train what you do.
Thank you so much for having me.